How health insurance works. Health insurance is complicated, especially if you've never had it before. Understanding how it works is helpful in understanding why it's important. Health insurance is like car insurance for your body. For example, you need health insurance in case your body gets in a wreck or an accident. If you get sick or injured and you don't have health insurance, you could end up owing a lot of money to get repaired. Health insurance will help pay those bills and keep you from going broke. One way that health insurance is even better than car insurance is that it helps to keep you healthy. You need checkups and shots to keep from getting sick. Health insurance pays for a lot of those maintenance costs. Here's an example of how health insurance works. Let's say you get sick with strep throat. You need to go to the doctor to get medicine so you can feel better and be healthy. The doctor bills for your office visit, the strep throat test, and for giving you a flu shot while you're there. If you don't have health insurance, you have to pay for all of that all by yourself. With health insurance, you only have to pay for part of the bill and the insurance company pays the rest. Now let's talk a little bit about how health insurance works. Every month you make a payment to the insurance company. You pay the same amount even if you never get sick or don't use it at all. This is what you pay just to stay covered. Think of it like a magazine subscription. You pay the same amount even if you don't read it. These monthly payments are called premiums. In order to learn more about how health insurance works, let's look at your coverage over the course of a year. Let's say you have to see the doctor because you are sick. You might pay for the first few doctor's visits. After you spend a certain amount of money at the doctor or hospital, insurance pays the biggest part of your medical bills and you pay just a little. The amount of money that you pay before the insurance company pays is called your deductible. If your medical costs add up to a lot, your insurance pays all of the rest of your costs for the year. This amount is called your out-of-pocket maximum. Insurance also pays all of the costs for some services, like annual physicals, some exams, and annual shots to keep you healthy. Health insurance helps you pay for the health care you need. If you don't have insurance, you pay all of your medical bills. If you do have insurance, you pay for a small part of the bills and the insurance company pays the rest. There are a lot of ways people get health insurance. Many people get health insurance from their jobs. Military veterans get medical care from the Veterans Administration, also called the VA. You can buy insurance directly from a health insurance company or an agent or broker. Adults over age 65 and some adults with disabilities can get Medicare. Many children under the age of 19 get Medicaid or Peach Care for Kids. Some low-income parents, pregnant women, women with breast or cervical cancer, and some elderly or disabled people may also get Medicaid from the government. Or you could buy health insurance through the Health Insurance Marketplace. It is also called the Marketplace, ACA or Affordable Care Act insurance, Obamacare, or healthcare.gov. Health insurance might not cost you a lot. You may be able to afford it. Here are ways that make health insurance more affordable for you. The government helps with insurance premium payments each month for many people who get marketplace insurance. The government pays some other health costs for people who don't have a lot of money. You can choose a health plan that fits your income. Not having health insurance can cost you a lot more if you have a serious illness or injury.
If you don't have health insurance yet, you may wonder if it's worth taking the time to shop for it or spending the money to have it. Let's find out if it's worth it. This is John. He just bought his new health insurance, so let's look at whether or not health insurance is a good deal for him. John makes $26,000 a year. His monthly payment is $100 per month. This payment is called a premium. His deductible is $2,000 per year. A deductible is the amount of money that John will pay before the insurance company helps pay his bills. In February, John goes to his doctor for his yearly wellness exam, which is preventative care. The bill is $230 and his insurance pays the full cost because it's a preventative visit. Preventative care is free. In April, John has an accident and has to go to the emergency room. The bill for his ER visit is $2,000. John has to pay all of this bill because he has not met his deductible yet. John develops an infection from his accident and gets a prescription for medicine that can make him healthy again. The medicine costs $200. John pays $10 because this is his copay for prescriptions, and his insurance pays the rest of the bill. John is having a tough year, and in September he has to go into the hospital for a 3-day stay. The cost of the stay is $4,200. John's insurance pays the bill because John met his deductible with his emergency room visit earlier in the year. In October, John has to have a follow-up x-ray. The cost of the x-ray is $600. John pays $10 because that is his copay for x-rays, and his insurance pays the remaining $590. John managed to rack up some big healthcare costs this year. Let's take a look at the final tally to see if John's insurance is a good deal for him. His total for medical bills this year was $7,250. He paid out of his pocket $2,020 of that, and his insurance paid $5,230. Now let's look at John's total cost for healthcare this year with insurance versus without insurance. With insurance, John paid his $100 premium every month this year for a total of $1,200, and his portion of his medical bills is $2,020. This is a total of $3,220 in healthcare related cost for the year. Without insurance, John would have to pay the entirety of the $7,250 in medical bills. So is health insurance good for John? Yes. John saved $4,030 with insurance. John was also able to avoid having to pay the penalty for not having health insurance, so it's an even better deal for him. We will talk more about this penalty in a minute. You may think that John's example doesn't apply to you. If you are young, have never been sick, and think you are pretty healthy, you may still wonder why you need health insurance. Let's take a look at a few reasons why. Most importantly, you get peace of mind knowing that you or family are covered if you ever do get injured or really sick. You are protected from unexpected high medical bills, and you can get the care you need. You also get free preventative services to keep you healthy at no extra cost to you. This includes free flu shots, a yearly wellness check, help to stop smoking, and more. It's the law. Everyone is required to have health insurance now. This means that you may be penalized on your taxes if you don't have health insurance. The penalty increases each year, so if you decide to go without health insurance, you should look into the penalty for that year. The health insurance marketplace, sometimes called Obamacare or healthcare.gov, makes health insurance affordable. The law says that you cannot be charged more because you are already sick or have been sick before. There is a limit on the most that you would ever have to spend out of your own pocket for healthcare. This is called the out-of-pocket maximum. Most people buying insurance on the marketplace can get help paying their monthly premiums. It's like getting a coupon for your health insurance payment each month. Some people are able to get additional help paying other healthcare costs. This help is called a cost-sharing reduction. People who make less money or have bigger households get more help. You can pick the plan that fits your health needs and your budget. You can buy health insurance from the health insurance marketplace as long as you don't get health insurance through your job, don't get Medicare, Medicaid, or VA benefits, are a citizen, or are legally present in the US. You can get help paying for your health insurance if your income falls between certain limits for your household size. These limits are 100% to 400% of the federal poverty level. Do not worry if you don't know what that means. We will give you some examples. For example, in 2016 and 2017, you are eligible for help if your household is just you and you make between about $12,000 and $47,000 per year. Your household is you and your spouse or dependent, and together you earn between $16,000 and $64,000 per year. Your household is you and 3 other people, for example, you, your spouse, and 2 dependent children, and together you earn between $24,000 and $97,000 per year. You can find out if you qualify for financial help by visiting healthcare.gov or by talking to a health insurance enrollment assessor near you. It's free. Now that you know that health insurance is worth it, let's talk about how to get it. You can apply for health insurance on the health insurance marketplace between November 1st and January 31st each year. If you are insured through your employer, Medicare, Medicaid, or the VA, you may have different times that you can enroll in health insurance each year. This period is called open enrollment. During this time, you can shop for health insurance for the first time, renew your current marketplace health insurance plan, or shop around to see if you can find a better plan. You may also be able to purchase health insurance during a special enrollment period. You may qualify for a special enrollment period if you have had a major life change such as A. Having a baby, B. Moving to a new region, for example, a new state or an area in your current state where your current health insurance plan is not offered, C. Your income changes a lot. If you think you qualify for an SEP, you have 60 days from the life change to enroll.
Before you start looking at prices or plans, there are some things that you should think about to make sure you pick the best plan for you or your family. First, let's think about how you and your family use health services. This will help you make sure that you get a plan that is the right fit. Here are some things to think about. Do you see the doctor a lot for sicknesses such as diabetes, asthma, or arthritis? Do you use a lot of medications? Are you going to need surgery or a special treatment soon? Or are you pretty healthy and mostly getting insurance just in case? Let's say you don't expect to use many health services. In that case, you may decide to buy a plan with lower monthly costs. But be careful. The less expensive plan could cost you more out of your own pocket if you do end up having unexpected medical costs, such as from a car accident. Next, think about the healthcare professionals you want to use. When choosing a plan, it's also important to think about the healthcare professionals that you currently use or may want to use in the future. So here are a few things to think about. Do you have doctors or clinics that you want to be able to go to or currently go to? If so, you can ask their billing department for the list of insurance plans they accept. If you don't have a regular doctor, ask around to find doctors and clinics near you that people like. Make sure you find a doctor you can get to. Are they on the bus route or near a train station? Is their office on the opposite side of the city or is it near you? Is there a hospital that you would like to go to if you had a big problem? Have an idea of what medical providers and hospitals you would like to use. When choosing a plan, make sure that the plan covers these providers and doctors. Lastly, do you have medicines that you take each day? Are those medicines covered with a low copay? Once you've thought about you and your family's healthcare needs, the next step is to get together the information and papers you will need when you sign up. Here's the information that you need to have before you sign up. Number 1, who is a part of your household? For signing up for health insurance, this means who is on your tax return, what are their ages and addresses. Keep in mind that some people in your household, such as college students living elsewhere, may have a different address. Some people that live in your house, such as a parent or a girlfriend, may not be included in your household. That means they're not on your tax return. Number 2, Social Security numbers for everyone in your household. Again, these are the people on your tax return. You need Social Security numbers for everyone in your household, even if they are not applying for health insurance. Number 3, proof of income, such as W-2s, pay stubs, and Social Security benefit letters. You will need all this information because when you sign up, you will need to make your best estimate of your income for the next year. Number 4, the address and phone numbers of all employers. Number 5, If you are a naturalized citizen or a lawfully present non-citizen, you will need your citizenship or immigration documents. Number 6, access to an email account. You will need to know the username and password to get into the account. Number 7, if you have ever applied for Marketplace health insurance, even if you didn't enroll, you will need your healthcare.gov username and password. Now you're ready to enroll. Just like when you shop for cereal or for a car, there are a lot of options to choose from when you buy health insurance. Let's review what you need to think about when you're picking a plan. Do you have a particular doctor or clinic that you want to use? Do you want a wide choice of doctors you can go to, or are you okay with having fewer choices? Do you expect to use a lot of health services, or are you getting insurance just to be safe? Can you afford bigger monthly payments so you pay less when you do use health services? Let's look at each of these choices a little more closely. Do you have a doctor or clinic that you want to use? All insurance plans encourage you to use doctors and clinics that are on their list. This list is called a provider directory. You will pay less money for using doctors on your health plan's list. These doctors are said to be in-network. You pay more money for doctors off the list. These doctors are called out-of-network. Balance monthly payments against paying out of your own pocket. When choosing your health plan, it's important to think about how much you want to pay each month versus how much you want to pay out of your own pocket if you get sick. This out-of-pocket cost is called a deductible. If you pay a larger premium each month, your deductible will be smaller. If you pay a small premium each month, your deductible will be higher. Let's say you go to the doctor a lot. You can save money by paying a bigger premium each month and having a smaller deductible to pay towards as you visit the doctor over the course of the year. Or let's say you do not use much healthcare and don't have any surgeries or special care scheduled. You might want to pay a smaller monthly premium and have a higher deductible. The next step in choosing a health insurance plan is deciding how much of your bill you want the insurance company to pay and how much you are able to pay. Your health insurance does not usually pay your whole bill. The portion that you pay out of your pocket is called the copay or the coinsurance. A copay is a fixed amount that you pay each time you use healthcare, like refilling your medicines. The coinsurance is a percentage of a total bill. Each plan has different copays and different coinsurance. Let's look at an example for each type of plan for a hospital charge of $1,000. For a bronze plan, the plan will pay $600 and you will pay $400. Bronze plans have the lowest monthly premiums, but the highest out-of-pocket costs. People in very good health might choose a bronze plan. A silver plan will pay $700 and you pay $300. Silver plans are a good balance between the monthly premiums and out-of-pocket costs. Most people choose a silver plan. A gold plan will pay $800 and you pay $200. Gold plans have high monthly premiums but lower out-of-pocket costs. Remember, this is just an example of what your bill might look like. We've simplified it here to show you the balance of premiums with out-of-pocket costs. Now that you've got everything together and you've thought a lot about your plan, you're ready to apply. Here are the places you can go to fill out your application. The best way to get help is by meeting with an in-person assister. They are licensed to help you enroll in Marketplace health insurance. Their services are completely free and they do not receive any payment from the health insurance companies that you might pick. These assisters are called health insurance navigators, enrollment assisters, or certified application counselors. You can find an in-person assister near you by going to localhelp.healthcare.gov. If you feel comfortable enrolling on your own, you can go to healthcare.gov and complete your application online. If you don't want to use the computer, you can call 1-800-318-2596 and enroll over the phone. If you select this choice, you won't be able to see the plans in front of you, but the person on the phone will describe the plans to you. You can also go to a licensed insurance agent or broker. If you don't have one already, ask around to see if friends and family have one that they trust and recommend.
Congratulations on signing up for health insurance. You've taken a big step in not only your own health and well-being, but your family and loved ones as well. Now that you've signed up for coverage, you should use your health insurance. You're paying for it, so you might as well make the most of it. Now that you've enrolled in coverage, you will need to make sure you have a primary care provider, or PCP for short. Your primary care provider is your gateway doctor, and this is who you will see on a regular basis. When choosing a PCP, it's important to make sure that they 1. Accept your health insurance plan, 2. Are easy for you to get to, 3. Have a friendly staff who are willing to answer your questions, and 4. Can give you an appointment quickly. Your PCP is who you will see for regular health problems and checkups. Your PCP will send you to special doctors if needed, such as heart doctors, skin doctors, pain doctors, or cancer doctors. If you have health insurance, you get preventive services at no additional cost. Preventive services keep you healthy rather than treating you for a sickness or injury. Try to remember these services so you know what you can get for free. When making an appointment for one of these services, make sure you tell the office that you are scheduling a preventive service. This list includes some, but not all services that are considered preventive care. You can see a full list of preventive services at healthcare.gov/coverage/preventive care benefits. You also need to make sure that your healthcare costs fit into your household budget. This is important to do so you can keep your coverage and are prepared for any out-of-pocket costs. Here's what you need to keep in mind for your budget. Every month you will need to pay your premium to keep your health insurance. You should save money to pay your deductible in case you get sick or injured. Save money to pay your part of the cost of sharing, such as co-pays for office visits, co-insurance, and medicines. You may need to pay for public transportation or for parking when you go to your doctor's appointments, so save for that too. Don't forget that during the next open enrollment period, you will need to renew your health insurance. If you do nothing, you will automatically be enrolled in the same plan if you've been paying your premium. But you should go back to your enrollment assister or to healthcare.gov to shop around for other plans. You may find a better deal or find that your plan has gotten more expensive. Also, remember that you must file your taxes every year in order to be eligible to continue obtaining health insurance on the Health Insurance Exchange. Sometimes you may have problems with your health insurance. For example, the insurance company may say they didn't get your last monthly payment, or they may say that they don't cover a service that you need. If you need help with problems like these, call your enrollment assister. They can help you fix the problem or connect you with someone who can.
When you were a kid or teenager, you outgrew your clothes sometimes and needed to buy new, bigger clothes. The same thing happens with your health insurance. Your life changes and you need different coverage from before. During each year's open enrollment period, it's important that you come back to the marketplace and shop for health insurance again, even if you just got it in the last open enrollment period. Here are a few reasons why. 1. The premium that you pay could have gone up or down. 2. The doctors and services in your insurance network could have changed. 3. Your income or your household could have changed, so the help you get paying your costs could have changed too. 4. The plan that you signed up for could have changed, or the provider may not be participating in the marketplace next year. 5. You could get a better deal shopping again for health insurance. The next open enrollment period will be November 1st, 2016 through January 31st, 2017. Go ahead and put it on your calendar. When your life changes suddenly, your health insurance can too. That means you can sign up for health insurance for 60 days after your life change, so you don't have to wait until open enrollment. You may be able to sign up for health insurance outside of open enrollment if any of the following have happened. You have a new child in your family by birth or by adoption, only if you had marketplace insurance before the baby was born or child adopted. You get married, only if you or your new spouse had marketplace insurance before you got married. Someone in your household died. You moved to a new state or region of your state, not just down the street, and had insurance previously. You lost your job or changed jobs, and your new job does not offer health insurance. You lost your Medicaid. You just turned or are about to turn 26. Your immigration status changed, or your income changed. If you think you may need to change your insurance coverage, you can always contact your local enrollment assister. It's free and it's smart.
Now you know how health insurance works, how to shop for health insurance, when you can get insurance, and how to find health insurance help. If you want more resources to help you get insured and stay insured, visit the Georgia Enrollment Assistance Resource at www.healthyfuturega.org/gear.